Namaste. This is Dr. Hema Divakar for the Health for Her YouTube channel, the playlist on high risk pregnancy. Yet again, we're talking about the testing for pregnant women for detecting high blood sugars, which is very, very crucial for the immediate short term and the long term care. Well, when you visit one doctor, they may say, there's no need for you to come fasting. Walk in any time. We will give you a 75 grams of glucose, mix it with 300 ml of water, drink it, just wait it along for 2 hours, and then we will take just one single blood sample. And if your reading is more than 140 milligram percent, then we need to pay attention to it because that qualifies for you being labeled as a case of gestational diabetes mellitus or high blood sugars in pregnancy. This is the standard test now accepted by the Government of India and by national and international professional organizations. In contrast to this, the other tests which are done in the Western world are called the two-step test. First is that the entire population of pregnant women are screened just to pick up potentially which of those amidst the thousands of pregnant women are more likely to have high sugars. So the first step is the glucose challenge with 50 grams. And if that sample shows a high reading, then they have to confirm it by the second test, where they will call the very same women who have tested positive in the screening back to the clinics or the hospitals first thing in the morning in the fasting state to give one sample, then give them either 75 or 100 grams of sugar, and then draw three more samples at 1 hour, 2 hour, and 3 hours. With all these readings tabulated, they will figure out whether the women then gets the label of gestational diabetes mellitus or not. Well, as you can understand, this involves multiple visits, multiple pricks, very, very cumbersome, especially in many parts of our own country, urban or rural. So we stick to the single step, one sample test as a non-fasting test, which is accepted all over the country. Lastly, the new era of COVID has forced many in the Western world also to step up or step down, I may say, from two-step to a single-step test. But the way they do it is collect a fasting sample, give a 75-gram glucose, and then do the 2 hour sample. So they do have multiple samples, but at the single visit because the number of visits really, really need to be minimized. In many parts of our own country, we even ask this test to be done at home with a finger prick on the glucometer, which will define the value of the blood sugar. So, from controversies to consensus, COVID has brought us all on a single page with a single step test. So, please do not fail to get this test done at the third month and sixth month of pregnancy. This is necessary for every single pregnant woman, no matter what your age is, no matter what your weight is, no matter whether your family somebody has diabetes or not. It is a must for all Asian women because we rank as having the highest potential to develop high sugars in pregnancy. So your health is in your hand. Do not neglect this. Just in case that you've missed out on this test, please do ask your doctor, confirm from him or her, and go ahead with the test to define your sugar status and take the due care if it is high. Namaskar, this is Dr. Hema Divakar for Health for Her.